Afternoon, everybody. Today is December 28th, 2020. This is the Falmouth Health Department. My name's Scott McGann, doing our weekly COVID update. This is a Monday update, but the data and everything that I've done is for Friday, so to keep things consistent, I'm still going to do the data, or all the data that I give you based on Friday. We'll do this again next week on Monday because of the holiday, and then we'll do a second one after that, getting back on Friday, so there'll be two the first week in January. That way we can get everybody up on and try to keep the data consistent. So to contact the health department, it's 508-495-7485, and that's for questions, concerns, complaints. We do take in the complaints and follow up. We may not get back to you, but we do take them in. Our email is health@falmouthma.gov, and our website is falmouthmass.us. So where do we stand? As of Friday, we had 664 cases of COVID since the beginning on March 19th, and that is all confirmed cases. I just added in that we've had 66 probable cases since 12/1, and the reason why I've done that is I usually don't do probable. We had very few probable. That usually means the antigen test, but one of the testing sites here here in Falmouth is also offering the antigen test. I believe it's Convenient MD. So now those mean something because we're starting to get those in. Now, there's also people that get probables also get the PCR. So the numbers aren't necessarily something you can add because some of the probables would have some of them would have gotten a PCR to confirm. So there could be one person with two of the numbers in there. But I think it's, for me to start giving you the probables is a good idea just because some people might just get the probable and not get it confirmed. And so with that being said, I'm going to start listing the probable cases because now that they're more common because of the different, and also some of the pediatricians' offices have had them, so I think it's good to start showing that in there. But we'll stick with we're going to stick with the confirmed as for what we do for most of the purposes, just sort of to continue on what we've been doing. There's been 83 cases over the past week from the 18th to the 25th. About 70% of the total cases are no longer in isolation. How I average that out is about 14 days roughly. So about 30% of our cases have all occurred in the last 14 days or so. So we're having a lot of cases. I know doubt about it. And it's true of the entire Cape. Falmouth is about 13.3% of all cases to date. Last week we were 13.8, so it tells me that the rest of the municipal counties had more cases on average than we have, but still 83 cases. This is a boatload of cases. That's more cases than I think we've had pretty much almost the whole summer. The VNA and the CTC, with the support from the health department, continue to perform the contact tracing, the isolations and quarantines and all that stuff. The CTC over the past week has added a lot of people, which has really cut down. We're having some difficulty with the CTC getting hold of people on a timely basis, which means the health department and my staff, we've been jumping in there before the CTC did. Now the CTC has added some staff and the support's been much better. The increase of cases, obviously, they are state agencies, so when the cases increase everywhere, their workload does. But we've established, they've had more help, and so they've been able to stay on top of them. One thing just to mention about that, if you do get called from the CTC, the VNA, or the health department, please answer our questions and work with us. Makes it more difficult when somebody hangs up on us or doesn't respond. So here's our chart for the week. You can see that what I did is you see that's our highest week to total. I don't know how many true cases were out there early on because we didn't have a lot of test kits back in the spring. But since we've been able to do adequate testing since about May, June, you can see that we're skyrocketing. I put the arrow. The two dotted red lines are basically non-long-term care. If you didn't have any long-term care issues, that's what your increase would have been over a week. You can see that even though we were doing about right around 70 to 75 cases over the past 3 weeks, 40% of those were long-term care. Well, right now we just had 83, and only about 8% of that was long-term care. So that's a lot of community spread. We're still coming out of the issues that we've had over Thanksgiving. Hopefully Christmas time that we did, everybody sort of took it seriously and stayed home and didn't, do a lot of visiting and a lot of parties, because if you have 10 cases and you go to 40 a week, from 10 a week to 40 a week because of Thanksgiving, now you're at 40, and so if you go from, like I said, 4 times more cases, we go from 40, we'd be at 160 cases per week, just using the same 4 times that we might roughly saw with an increase over Thanksgiving. So we want to make sure that hopefully that didn't happen. And we'll find out, sure enough, over the next week or two as we're doing contact tracing and I do these presentations, you'll see how many cases happened from that. So that's not a good trend. Hopefully we can flatten that out. I mean, this weekend hasn't been a ton of cases, but also we had the holidays, you had less testing. We'll see what happens throughout the week. You can see, of course, our weekly case rate is definitely on a very fast pace growth since about Thanksgiving week. And everybody, I'll talk about that in a minute, that everybody needs to start thinking about what they did earlier in the spring to stop the spread, because we need to have that occur now. As far as our metric, again, 43 cases is our cutoff between green and yellow, or 5% positivity rate. If you're both over 43 cases then you're also above 5% positivity rate, you would click to red. We remained in the yellow for the time period of 12/6 to 12/19. Again, the state puts this out on Thursday, but it does it for the 2 previous full weeks. You can see our percent positivity went to 3.93, and you can see that we've been increasing from, let's look at 1% on 11/11. Now we're at not that much longer, 6, 7 weeks, 8 weeks later, we're at 3.93. If we hit 5 with the number of cases that we have, we will be going red. So where our positivity has gone up, I mean, we do robust amount of testing. We're over 2,000 tests per week, and that helps keep our this percent positivity down. And then we're also seeing the highest number of 29, almost 30 per 100,000 is our incident rate. Compared to the county, we're still a little bit better than the county. The positivity rate is pushing 5% at 4.85. So we're not quite, but almost 1% lower. And our average daily incidence rate is slightly lower. Compared to the state, we're about half. So in terms of the state incidence rate, we're half of the state, a bit better than the rest of the county, but we're not in great shape compared to ourselves and what we've done earlier on. So we've sort of mimicked what's been going on. We've always done sort of better than the state and right around average or so for Barnstable County. And so, kind of in that same boat, and as everything increases, we see the increases as well. This shows the chart on the left, talks about our testing rate. The darker the color, the better. The lighter the color on the right, the better. You can see that we're still sort of holding our own. Our percent positivity for the Upper Cape is about what the Upper Cape is, with Mid Cape really still sort of suffering, and also Nantucket. But again, we've always sort of been dark green on the left, which tells us that we've always been robust with the amount of testing coming out of Falmouth, which is good. We do have a lot of long-term care. We have some congregate care. We have the hospital. We have medical facilities. So we have more frequent testing being done than maybe some of the other typical towns, other towns that you see. This is a little bit old. This is the last time Barnstable County's updated it was the 23rd. I apologize, but I don't have a more update chart. I did look right before I started this. But you can see, of course, that we've been in that high range. And it hasn't really tailed off, and it'll be interesting to see what happens over the next week or so. The state dashboard, which tells us, which is every day, you can check this around 5 o'clock on a daily basis. This particular date was Sunday the 27th, the most recent one. It was 3,000 positive with 41,000 tests. When we do days where we have 100,000 tests, we end up with around 5,000 or 6,000, which gives us around that 5 to 6 positivity. The 7-day average right now is really high at 6.28. The average age of death is 80, with the average case of hospitalization is 69. Nothing new. 100 confirmed report. That's a much higher number. We had been most days in between 30 and 50. We have about 2,100 people in the hospital in the state, 416 in the ICU, with the average turnaround time for a PCR test being pushing 3 days, and that's an awfully long time to have to wait. Remember, if I didn't mention it before, if you are symptomatic and you're waiting for a test result, you need to self-isolate. You shouldn't be waiting and doing your normal business, especially being symptomatic. Now, if you're somebody who's being tested every 72 hours or every week as part of your job, then you don't need to quarantine. But if you got tested because you're symptomatic or you're close contact of someone, you should be self-isolating. You could be spreading it and not knowing it. As far as our public health indicators, we're up as far as the 7-day average for new confirmed cases for the state. The 7-day weighted average positive molecular testing rate, we're up. And our hospitalization is up, and our deaths are actually down from last week. So this is just based on what the numbers were last week. The last time I did this on the 18th, 3 out of the 4 are up. But they're all up in general, but they're just compared to like last time. Confirmed cases, again, are much higher than they were at any point. Then again, early in May, late April, somewhere in there, we weren't getting enough tests out there, so we don't really know what the burden was then. But we know we have a boatload of cases now. Percent positivity is high, especially when you factor out the light blue number, which is higher education only. If you factor that out, and our average is no longer the blue, it would be the orange line, which is about 7% positivity for the state. That's a very high number. It needs to be getting under control. Hospitalization, again, we're up 549 from 12/11 for the state and 1,549 from early November. So our hospitalizations are definitely increases. Not quite at the same rate that our cases are increasing, which, because we're doing a better job capturing all patients. Again, coming back up a couple slides to here, we see that under the age of 40 is where most of our cases are coming. We're doing a better job between 65 and older, so then we tend to have less hospitalizations based on the number of tests, another positive test. So we have more positive people, and even though we are getting an increase in hospitalization, it's not quite at the same rate that you would have seen earlier, that you would have seen if it was hitting that age group at the same rate as it was hitting the younger age groups. ICU visits are up 109 from the 11th and 62 from the 11th. So that's where we're at with the ICU and intubations. Intubation means the ventilator. Hospitalizations, again, are on the increase. Again, it doesn't appear to be at the same rate. Our hospitalizations were higher in May, which tells us one or two things that two things that we know. We were definitely missing a lot of cases that weren't being tested early on, and also we weren't protecting as well the vulnerable population, so therefore that's why the hospitalizations were as high as they were. They are high now, but not quite as high as one might have thought with the number of cases that we've had. So getting into hospitalizations locally, I only have the most recent data I have is the 22nd, which showed 7 at Falmouth Hospital, 2 in the ICU. Cape Cod Hospital was 23 and 3. The numbers are probably slightly higher right now. But that's where we are, at least as of the 22nd, which is the most recent data I have with the holidays and so forth. I did not get an update from the county. Barnstable County usually gives me an update, and I take this and make a slide out of it, but that's the most recent data I have. Hospitalizations, the 2 long-term care facilities have slowed down for cases. It's typical. By the time you find out what happened, you've got a ton of cases, and then as you start to follow COVID procedures, it lessens. It's not at 0 at either places, but it's definitely a lot less, which is good. There's been there was about 150 plus, a little over 150 deaths associated over the last week in long-term care, which has usually typically been about 2 out of every 3 deaths have been associated with long-term care. COVID testing hasn't changed. You can still call the Cape Cod Health Center. This number is, I just joined at the Constable County Fairgrounds. The drive-through at the fairgrounds is actually a new number. I'm sorry I didn't update it. I missed that. Because with both of them being at the call center, the 862-5595 number, and then using the Barnstable County test sites, which is at the fairgrounds. There's 1 or 2 going down Cape, and then the Melody 10, I think, is another one. With those calls and the calls at the Cape Cod Healthcare, the number crashed last week, and they came out with a new one. But if you do go to the Barnstable County website and just do COVID testing, the new number's there. I apologize for that, but there is a new number for that due to the call volume. But you can get at the drive-through, it gives you the times and hours operations on the website. If you can't find that, you can call the health department. We can provide that to you. The drive-through test site's operational right now at the fairgrounds. Again, Convenient MD, the East Falmouth CVS, the Community Center, Health Center of Cape Cod, still places you can get a test. Like I said, I believe it's Convenient MD now has an antigen test. Cape Cod Healthcare, again, is the same number. That's with a referral from a physician. So there's still places and opportunities to get tested. And apparently we are, because we are averaging over 2,000 tests, so people are getting tested. And so, again, the antibody test, you don't see that anymore, so I'm not going to talk about that. The antigen and PCR, antigen's a rapid test, okay? Not nearly as accurate, but it is definitely accurate enough to use. It's considered a probable. PCR would be what you would want to get after it to confirm that you've actually got the disease. And it's very, 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 very sensitive. But it does take now, you're pushing 3 days for results. So if you got an antigen test, you had symptoms, you got an antigen test, treat it as a positive. You self-isolate yourself from everybody else as best you can. If you want to get a PCR to definitely confirm it, you can. But if you've got symptoms and a positive antigen, odds are that you do have it. So that's why I wanted to start showing the antigen tests, just because we're starting to see more people in the community starting to utilize the antigen test. Sorry about this busy, but beginning on 12/26, if you want to go to mass.gov, you can see all the different sector-specific capacity gathering limits. For example, general gatherings at 10 persons indoors, 25 outdoors. Restaurants are 25%. Close contact personal services are now 25%. Indoor and outdoors are 10 and 25. Movie theaters are 25%. Casinos, we don't have any 25. Offices are 25. Places of worship are 25. Retail businesses are 25, excluding staff. So the occupancies are down. I would not be surprised if the governor, after the holidays, restricts it further, based on the current case counts. Don't know, haven't been told otherwise, but I wouldn't be surprised. So if you're a business and you're hearing this, you might want to consider that might actually become more stringent in January. I have no knowledge of that. It's just my opinion, but you might start seeing it just because of the sheer amount of cases that we're getting. As far as social distancing and face coverings, it's time to start implementing the things you did to keep yourself safe in the spring now. So there is more cases that we know of than at any time of the outbreak, okay? And it's time to start thinking of the things that you did. So if you limited the amount of things that you did as far as, taking trips out of your house and you're high risk, you need to start thinking that your risk to getting COVID is higher now than at any point. Now, we don't know exactly early on in March and early April when we didn't have enough test kits what that burden was, but I can say since we've gotten somewhat of a grip on it with March, since maybe early May, your risk of getting it now is higher than it's ever been, and that's true whether you're in Falmouth, Barnstable, Brockton, or Boxford. So, that's something to consider. The continued diligence with wearing facial coverings, social distancing, hand washing, hand sanitizing, reducing or eliminating travel. You have to travel. The quarantine guidance needs to be followed. Avoiding gatherings, parties, especially indoors and without any social distancing. You would be surprised. A lot of people are very surprised when they get it. They don't think it necessarily can happen to them, and it most certainly can. So you may think everyone's healthy, and stay at home when ill and follow the state guidance, which now is phase 3, step 1. And if you're a business, you need to be following the guidance. If you have a complaint about a particular business, we will follow up with that business. But please just start thinking about the different things and the tweaking that was happening that you were doing in the spring. That would go a long way. Now, good news, because I'm sick of talking about bad news. COVID vaccine, Cape Cod Healthcare has started already vaccinating. Gotten through a lot of their staff. Phase 1 is the clinical and non-clinical healthcare workers. Long-term care facilities aren't far behind. Police, fire, and emergency are within another week or two. We'll have that. We've got that all set up. Congregate care settings, home-based healthcare workers and healthcare workers doing non-COVID facing care that's already in process. Great. Phase 2 is individuals with comorbidities, 2 or more, 65 and older. This is in early education. This is starting sometime in February. You don't need to call the health department to put your name on a list at this point, only because the state has asked us to focus in on the police, fire, and emergency right now, and we'll start focusing in on phase 2 when the time comes. We are starting to think about the clinic, how we're going to do it, but we don't have quantity. We don't know exactly whether the only place you can get it is through the health department. Will there be other avenues? So it's a little early for us to be taking the names. We will be, sending out as much information as we can as we learn more from the state. And then, of course, phase 3 would be the general population between April and June. So that's where we are with the vaccine. This is a slide that I've made up just for myself. This is showing the different departments and things that we need to get into. I'm thinking about how to do the distribution of the vaccine, how to track 21 or 28 days, depending on which kind, scheduling, following up, things of that nature, setting up all the volunteers. So it's quite a monumental thing to have to set up, and we'll be setting that up and going through all this probably starting next week, just figuring out where and how many. And the state hasn't told us whether we're going to have it trickle in at 500 or are we going to get 5,000 doses. If we get 500, it's actually harder to do smaller sort of things, because then, what 500 people get it and so forth. So we're working on that. We don't just have a lot of details from the state yet about exactly how this is all going to function, so we are going to have to be fluid with it. But that's the good news. We do have a vaccine, we've got a couple available and a couple more right down the pipe. So as a recap, the vaccine's been approved and is being administered at Cape Cod Healthcare for staff, first responders within the next week or two. State metrics everywhere are very high. Falmouth cases are the highest since the beginning of the pandemic. You need to know that. There is community spread. You can get it. So you need to take the precautions that you were taking early in the spring. And again, if you get contact traced, please give us all the information. Get tested if you have even mild symptoms or any type of exposure that you know of. And just start bearing down over the next. So what's going to need to happen is we're going to be bearing down over the next couple of months, and as the vaccine starts to get into the population more and more and more, the cases should start to drop down. But that's going to be a process, and it's not going to happen immediately. So we're just going to have to keep bearing with it. And that's all I have for this week, and we'll see you again on next Monday, right after the New Year. Happy New Year, everybody. And then we'll do 2 that week, and we'll catch back up on Friday. So Monday and Friday of the following week. And take care. Thanks.